Million Americans report suffering from clinical depression every year, and according to the National Institute of Mental Health, more than 16 million Americans experienced at least one major depressive episode in 2016, almost 7% of all adults in the country. A staggering 50% of those who experience symptoms of depression won't get any treatment at all. Those who do are often prescribed traditional antidepressant medications.
But what if those medications don't work for you? Valerie Poncetti has a look into some alternative depression treatments found right here in Acadiana.
Depression is the leading cause of disability in the United States, according to the Anxiety and Depression Association of America. It also tops the same list across the globe.
Difficulty sleeping or, hypersomnia, sleeping too much, guilt, feeling worthless, feeling sad, most every single day, problems with focus, concentration. There's even, you can have intrusive thoughts of, wanting to harm yourself.
First, most medical professionals, like Lafayette-based psychiatric mental health nurse practitioner Matthew DeCluett, will encourage patients to try prescription medications to get some relief.
You want to really pry and dig and see what they've tried and get specifics of how long they've tried medications.
But if you've exhausted all of those avenues, DeCluett says thinking outside of the box or bottle for treatment is not a bad idea.
TMS, ECT, even ketamine, if the client's appropriate for it, I think, the main goal is symptom remission. So I think if medications aren't working fully, then I think those approaches would be definitely beneficial for the client.
Professionals skilled in at least two of those techniques are practicing right here in Acadiana, using ketamine therapy and transcranial magnetic stimulation, or TMS, to treat patients. While the approach for each is completely different, both were discovered the same way, by accident. Ketamine came along in the form of a battlefield anesthetic in the 1960s.
Put them to sleep so that they could do a quick procedure. Well, a lot of these soldiers that got the ketamine were found to be almost in a kind of an unusually chipper mood after.
Fast forward a couple of decades to the birth of TMS in the 80s, with the help of a doctor whose patients' treatments involved a whole lot of MRIs.
And this doctor started noticing these people's mood was improved. Although they were suffering from a chronic disease, the exposure to the MRI had done something to them.
As explained by nurse Alan Green, ketamine infusion works by way of a chemical reaction. Patients are given the drug slowly through an IV, then the body's reaction to the ketamine releases something called glutamate, a neurotransmitter which Green says can repair damage to the brain caused by depression.
Imagine a tree in the winter. It's got no leaves, branches are kind of wilting, there's just nothing to it. You give it sunlight, come spring, all of a sudden now you've got full branches, you've got leaves, you've got a much stronger tree.
TMS deals with neurotransmitters as well, but in this case, a magnet is placed near the patient's head where an electric current is released.
We use magnetic therapy in a way to train their brain to learn how to depolarize your neurons and continue to learn how to depolarize your neurons and repolarize.
As for concerns like negative side effects, Green says even though ketamine is known to be abused as a street drug, patients are given an extremely low dose and monitored carefully. And if you're considering TMS, co-owner of TMS of Acadiana, Bruce Baudouin, says it's important to know that a full 36-session treatment is equivalent to the magnetic exposure of one MRI. These aren't the only alternatives to prescription medications for treatment-resistant depression out there, but those who've seen success in the techniques say they're more than worth a shot.
Most people who have depression, their brain wasn't functioning correctly in the communication way. So we give them the neurotransmitters needed for communication. Once their brains start effectively communicating by what we've taught it to do here, then depression tends to go away.
All of a sudden, hey, I was able to eat a full meal last night, or wow, I slept 8 hours last night. I went and took my dogs for a walk. I went and played with my kids.
In Lafayette, Valerie Poncetti, KATC TV 3.
And right now, TMS therapy, as well as many traditional prescription medicines, are covered by some insurances. While ketamine infusion isn't covered just yet, doctors do say the costs continue to go down, though. Head over to KATC.com for links for more information on depression and different types of treatments.
And still